Yeah. Come on, share your experience. Yeah. Yes, writing workshop. Yes, writing workshop. Yes, writing workshop. Formal feedback. Writing workshop. Yes. Come on, share more problems, more problems. I'm giving you 30 seconds more. Yeah, yeah. Get ready. Yes. So we are going to learn some sentences. write down 3 excellent sentences which you use in your writing. Any sentences. Okay. Write down 3 very good sentences you use in your letter. Yes. Yeah, write down your sentences, please. Any sentence, any 3 sentences you want to write. In the meantime, I will write my sentences. Yes. My first sentence is, I hope you have started writing your sentences because it's very important. I'll be correcting your sentences. Even if you can write one sentence also, that one sentence getting quality correction is more important. Yeah. Number 1. Thank you for seeing this 43-year-old. What is the style I am writing? This is standard, okay? Patient with right lobar pneumonia for assessment. This is sentence number 1. Yeah. Mrs. Hong has a past history of rheumatic arthritis. Yeah. Mrs. Hong has a past history of rheumatic arthritis with resultant mitral regurgitation, and atrial fibrillation. So now what you can do is you can try to write your own style of sentences. You can write your own style of sentences. Come on. Take these as samples, change the name, change the style, change the age, change the patient's name, change the diagnosis name, change the requirement name, anything, change everything. Yes. Number 3. Her usual medications are digoxin 0.125 mg every morning, comma, and warfarin 4 mg every night. Yeah. So this is the third sentence. Come on, write down your sentences. Change everything. Okay. Yeah. Next, fourth sentence. She has no known allergies. Number fifth sentence. Her last prothrombin ratio taken on her last prothrombin ratio taken on 9 February 2010 was 2.4. Yeah. Yes, write down your sentences. Whatever sentences you want to write, you write. Yeah. Whatever sentences you want to write, you can write. All the regular students, write down your sentences because you are sentences will be physically corrected and the guests orally told, informed. Yeah, Diana Victoria Perez. Okay, Victoria Perez. Very good. So, Diana has been seen for her cardiologist for the last 5 years. You have grammar mistakes, Victoria. You have order also, sequence problems. Diana has been seen by her cardiologist for the last 5 years. Where for is there, there you put by. And for the last 5 years, so two mistakes in one sentence. However, she needs to be evaluated by an infectologist due to ongoing symptoms such as fever and increased high blood pressure. Increased blood pressure is high only. So, right? Fine, good. Yeah, for the guests, we'll give oral explanation, and for the regular students, we will give the written format. Yes, please, come on, participate seriously. Yeah, come on, write down one sentence at least for each example. Yeah, 5 sentences I have given you. Yeah, Farah, very good. Good participation. Victoria and Farah, good participation. Carry on. Thank you for saying Miss Lima. 40 years old. No, that's not right. You have to write like this with a hyphen. 43-year-old. Okay. Who has been diagnosed with mitral valve prolapse. Her mother is hypertensive. She has been on her regular medications for the last 3 months. Yeah, grammar mistakes are there. We'll learn number of sentences again. Yep. So, one after another, I'll be giving you the sentences afterwards. First, I will give you sample sentences. Then you will write your sentences. Then third stage, I will correct your sentences. And fourth stage, yeah, a question answer session. Yes. So 5 sentences. Write as many sentences as possible. Next, today, immediately after today, you have to put a comma. Everyone. She presents with a 6-day hyphen like this. No days. Don't write days. A 6-day history of productive cough, with associated fever and lethargy. Yeah. So today she presents. You can write the name or he presents, he reports. However you want to write, you can write. She visited, she presents. Anyway, change the words. Today you can say, yesterday you can say, okay, 1 week back you can say, 2 months ago you can say, anything. Change any word, anything. But see that it is right as far as possible. Do mistakes, no problem. Be daring to do mistakes because I'm going to correct your sentences. Yeah. Next, seventh sentence. This was treated initially with oral amoxicillin. Okay, this was ineffective, so I'm putting in brackets. Initially it was used, but afterwards it was changed. And then chest physiotherapy. Okay, and then chest physiotherapy. But today she has deteriorated but today she has deteriorated with tachypnea and right pleuritic chest pain. So this we can make it into two sentences now. This was treated initially with oral amoxicillin and then chest physiotherapy. Then it was changed to chest physiotherapy. Okay, now what we'll do is we'll make these two sentences. But today, from there. However, comma, today, comma, she has deteriorated with the tachypnea and right pleuritic chest pain. So like that. Very good, Kaval. Miss Sally was admitted to the hospital, not even a single mistake. She underwent laparoscopic surgery for endometrial cyst. Very good. Not even a single mistake. Awesome. Awesome. Good. Good. You're doing very well. Kaval is my regular student. Kaval is registered regular student. Okay. Kaval. Hello, Kaval. Answer.
Yes, sir.
Yeah, you are awesome. Okay, lot of improvement I have noticed. Lot of improvement. Okay. Uh,
Okay, thank you,
so
sir.
you have written
Yeah,
three.
just
You have
yeah.
written 3 letters and 2 letters were correct. 2 letters and 2 letters corrected on the very same day. You send another letter that is also corrected, but I have to edit and I'll send you. Okay.
Okay, thank you, sir. Yeah, I have booked the exam. That's why I am
Very good.
struggling.
Very good. Yeah. Very good. Very good. That's good. I'm there to support you. Okay. Yeah.
Okay, thank you, sir.
Right. Right. So write down the sentences, please. Yes. The right lower lobe is dull to percussion. The right lower lobe, yeah, yes. The right lower lobe is dull to percussion. The right lower lobe is dull to percussion. Try to imagine the scenario and try to, instead of right, you can say left. Okay, instead of lower lobe, you can say upper lobe or what, however you feel. Okay, is active or it's dull. Okay, so how you want to do uh, percussion, palpation, or observation, monitoring. So change whatever word, but accordingly you suit your sentence. Right. The right lower lobe is dull to perception. Crackles are both are present. Crackles are present in both the lungs. Crackles are present in both the lungs. You can say the left lung, the right lung, or both the lungs. Crackles are not are absent in both the lungs. However you want to write, you write, or try to write different sentences. Crackles are present in the left lung. Crackles are present in the right lung. Crackles are present in both the lungs. Crackles are not present in the left lung. Crackles are not present in the right lung. Okay. Crackles are not present in the lungs. Okay, in both the lungs. However you want to write, you write, modify, change. We only want sentences, learning sentences. Okay, then afterwards we can adapt the sentences to the so how to write sentences. Yeah, next, number 11. Crackles are present in both the lungs. Yeah, here you can say worst at the right base. Yeah, next, her temperature is 38 degrees centigrade. 38 degrees centigrade. Degrees, we have to put O. Degrees centigrade. Yeah, 38 degrees centigrade. Her temperature is 38 degrees centigrade. Yeah, you can change. His temperature is 49 degrees centigrade. Whatever you want to write, however you want to write, you can write. Her temperature is 38 degrees centigrade. BP, space BP. So blood pressure 110 by 75, 110 by 75, comma, pulse 110 brackets irregular. Okay, and her usual systolic murmur, and her usual pansystolic murmur is louder than normal. Yeah. Her temperature is 38 degrees centigrade. Blood pressure is 110 by 75. Pulse 110 irregular. And her usual pan-systolic murmur is louder than normal. Okay. You'll learn many sentences today. Yeah. So change the words and change everything and write down. Yeah, Keval Shah, her physical examination was unremarkable. However, alcohol withdrawal symptoms were noticed. Very good. As a result, she was further managed with the required treatment. Okay, fine. That's very good. Okay. With the further treatment. But what is the treatment? You did not say. So it is a generic, be specific. What type of treatment? Physiotherapy or something or what? Okay. Right. Next. Yeah. So write down your sentences. Change everything, whatever you want to change. Yes. Number 12. Number 12. Write down your sentences. Okay. Instead of however, you can say alternatively. Okay. Cover. On chest examination, the apex beat was noted in the fifth. And 5th you can write FIFTH. Don't write numbers as far as possible. Okay. If it is small numbers. The crackles were heard at the base of the left lung. Very good. Very good. Why are you not giving any spelling mistake and grammar mistake, Kaval? You're very bad. I thought you will be very good. You'll give me lot of mistakes to correct, but you're not giving me mistakes. Why? Hmm? Maybe the feedback and the corrections are helping you. Good, good. Go ahead. Uh, Sputum M and C. What do you mean by sputum M and C? Okay, let me check. Sputum M and C. Micro and culture specimen. So you should write full sputum for micro and culture specimen. Okay. So sputum for micro and culture specimen. Okay. Like that you have to write. Showed or revealed. So showed or revealed. Revealed gram positive, gram positive streptococcus, streptococcus pneumoniae, pneumoniae. Yeah, that is number 12. So you can take some other example of culture, some other laboratory test. It revealed what? Asthma, maybe. So any change anything everywhere. Okay. Next, the X-ray. X should be capital and hyphen X-ray. It should be written only like this. X-ray showed opacity in the right lower lobe. In the right lower lobe. The X-ray showed opacity in the right lower lobe. Come on. I believe her rapid deterioration, warrants inpatient treatment or emergency admission. However, you want to change, I believe, okay, she requires, instead of I believe, she requires, okay, on account of her rapid deterioration, she requires or she demands or her condition demands, her condition warrants emergency admission and immediate treatment. However you want to write, you can write. Change everything, change everything. 15. I would appreciate your assessment and advice or recommendation or suggestion, assessment or evaluation or examination. Anyway, you can change. I appreciate, I would appreciate, I would definitely appreciate your assessment and advice would be appreciated. Change any style you want. Okay, any style you want. There is nothing like this is the only style. I would appreciate your assessment and advice regarding Mrs. Hong. Yeah, yes. Next, 16th. I will be in touch to follow her progress. Okay. Please update me. You can change this one into any other style. I will be in touch to follow her progress. Please update me the status of Mrs. Hong or keep me informed about the regular updates. Regularly update the condition of Mrs. Hong. Any way you write, I don't mind. Okay? Any way you write, I don't mind. Come on. Yes, write down your sentences. Yeah. Yes. Now 17. Okay. Thank you for seeing Mrs. Priya Sharma, a type 2 diabetic diabetes type 2 diabetic a type 2 diabetic or diabetes mellitus patient. Thank you for seeing Mrs. Priya Sharma, okay, who has, okay, type 2 diabetes, who was diagnosed with type 2 diabetes mellitus. Okay, type 2 diabetes mellitus. Yeah, learn different styles of writing. Okay, write your own sentences. Participate, please. I'm trying to give you double dose today. If you don't participate, then I will end there only. Okay, write down your sentences because I'll give you this printout, no problem. Yeah, these are all good sentences which you can modify. Okay, so I will be in touch to follow her progress. Regular updates are anticipated. I'll give you better sentences later. Come on, come on. These are only B grade sentences. I'll give you A grade sentences. Okay. Kindly update me on a regular basis regarding the progress of Mrs. Hong. Like that. Lot of sentences I'll give you. Yeah. Yes, please. Next. Yeah. I would be grateful. I would be grateful if you would assist with her blood sugar control. I would be grateful. I would be grateful if you would assist with her blood sugar control. Yeah. I would be thankful to you if you could assist her with controlling or managing her blood sugar levels or stabilizing her blood sugar levels. Write in many different ways. Okay. Write in many different ways, please. Yeah. If you want to write about age, how you are writing? Mrs. Sharma is 60 years old. So you can say Mrs. Sharma is a sexagenarian. Sexagenarian. Okay, different style. What do you mean by 60 years? Sexagenarian. What do you mean by that? Let us check the Cambridge Dictionary. SEXAG, sexagenarian, means a person who is between 60 and 69 years old. So you can write the word sexagenarian. This shows that you are very qualified, you are excellent and outstanding. Okay. So you Mrs. Sharma is a sexagenarian. Like that you have to write. Okay. Then she has a strong family history. See, words are repeating, sentences are repeating, of diabetes. Diabetes. She has a strong family history of diabetes. See, the sentence is coming many times. That means this you can use in the exam. Okay. Yes, 21. She was diagnosed with non insulin dependent diabetes mellitus in 1994. Yeah, in 19, when a year is given, past year is given, you have to write past tense. She was diagnosed. Okay. Recently means she has been diagnosed. Good, Cable. That's fine. Yeah. Next. She was diagnosed with asthma in 2014. She Her signs and symptoms are suggestive of. Okay. Right. Or you can say she was admitted with okay. She was admitted with, or she was given treatment, or whatever you want to write. Try, modify, change. This, keep this as a model. That's it. Try to create and recreate your own quality, your own sentence. Imagine, I want only sentence right. That's all. Grammar and sentence right. Vocabulary right. That's all. You write in any way possible. No problem. Okay. Romasa, I am not able to see your sentences. Yeah. How you properly use since. Since means a starting time. Okay. So she has had diabetes mellitus since 1994. Since is used for starting point. Okay. So I'll give you the example here. Yeah. She has had, okay, diabetes mellitus since 1994. Yeah, this is what you will write. Or she has had diabetes mellitus for the last 2004, 2014, 2024, for the last 3 decades, means 30 years. So since is used in this, since used with the starting point, use the since. Okay. Since with starting time, starting point of time. Okay. Then use for the last. You have to use for the last with a period of time, not point of time, period, time period, period of time. I hope you understood. Is that clear? Okay, Keval, very good. That is very clear. Yeah. So, since should be used since 1994, starting point of time. She has had diabetes mellitus for the last 3 decades or for the last 30 years. That shows period of time. Okay, duration. Okay, this is commencement, this is duration, we can say. So, period of time is equal to duration. Okay, duration. And this is point of time. This is called commencement. Commencement. Yeah, remember that. Okay. So this is how you will get more points. Romasa, what happened? Your sentences I'm not able to see. Okay. Uh, yeah. Then that only send in the group. Don't ask what I will do or lose. Stop questioning and do things. What I told, do and send in the group. You are sending in the group now. You are doing right. Send in the group. Or don't do it. Leave it. Mm. Sir, how to merge one positive and negative sentences using but or however? Using but or however. Mrs. Sharma is 60 years old, but she has, okay, but she has a strong family history of diabetes, like that. Yeah. Yes, please. Come on, write down. When you participate like this, you'll get more doubts like this. Okay. She is physically, she is physically very active, but, okay, she is physically active, but she does not participate in any physical activities or exercises. See, this is how you can write. Okay. But contrasting sentences, negative and positive sentences, like this. Then 23. Yeah. Yes, next. Next. Right. Yeah, she was diagnosed with non-insulin dependent diabetes mellitus in 1994. Yeah. She has been success. She has been successfully monitoring or following up or observing her blood pressure and sugar levels at home since 1994, since then, or since 1994, or since she was diagnosed. Okay, means from that point of time. 24. Go down. Yeah, 24. She first attended she first attended my surgery on 29 January December 29 December 2013. She first attended my surgery on 29 December 2013. She first attended my surgery on 29 December 2013. She was concerned about she was concerned about her she was concerned about her blood sugar she was concerned that her blood sugar levels she was concerned that her blood sugar levels were no longer well controlled no longer well controlled. Yeah, she was concerned that her blood sugar levels were no longer well controlled. Yeah, she was concerned that her blood sugar levels were no longer well controlled. Yesterday we have seen only 20 sentences. Today we are seeing almost 40 sentences. No longer well controlled. On initial presentation, comma, her blood pressure was 155 by 100 and she she on initial presentation her blood pressure was 155 by 100. Full stop. First learn writing small sentences. Afterwards we can make big sentences. On initial presentation her blood pressure was 155 by 100. She said that her sugars blood sugars were running between 6 and 18. Yeah, her blood sugars were running between 6 and 18. Next, her medication at that time, was metformin 500 mg, metformin 500 mg twice every night, and glipizide 5 mg every morning. Yeah, 29. Mrs. Sharma is allergic to penicillin. Mrs. Sharma is allergic to penicillin. Yeah, I'm going to give more different ways of writing these sentences. Okay. Once I explain, write these sentences, you write your sentences. Afterwards, I'll give. Okay. Mrs. Sharma is allergic to penicillin. This can also be written in a different style, What allergy to penicillin has been noticed or notified So like this, you can use different. I'll give you different sentences. Advanced. This is only B grade sentence. Okay. This is only B grade sentence. The first one is only B grade sentence. This is A grade sentence. Okay. So this is active voice. This is passive voice. This is Mrs. Sharma. Here no Mrs. Sharma. So quality wise it is improved. Yeah. A pathology report on 5 January 2014, a pathology showed or revealed HbA1c levels of 10% and GFR. GFR. What is this GFR? What is this GFR? GFR, medical abbreviation. Glomerular filtration rate. Yeah. If you know, you can write this one better. Okay. So GFR. Okay. GFR. So brackets GFR. Okay. So you're learning new words. Yeah, glomerular filtration rate. Very good. Thank you, Romasa. You are there participating. Very good. Yeah. So how to improve these sentences? These are B grade sentences. How to improve these sentences? I'm going to tell you. Okay, GFR. GFR. Um, yeah, greater than 60 ml. 60 ml per minute. Okay, 60 ml per minute. Yeah, 60 ml per minute. Next, her cholesterol, her cholesterol was high at 6.2. 6.2. Okay. Yes. On 29 December 2013, comma. So how you write the date? This is how always whenever there is a date, you try to write in the beginning of the sentence. On 29 December 2013, comma, I instituted Atacand 4 mg. Atacand 4 mg. Okay. One tablet 4 mg. One tablet every morning. Yeah. I recommended or I advised. I recommended or I advised. Means since that time, monitored blood pressure has been within the acceptable range. On on 12 January 2014. See the style of writing the dates. Always better to write in the beginning. On 12 January 2014, comma, I also prescribed. See, this is not a very good sentence, but it is a B grade. Instead of I prescribed, this was prescribed will be better. Lipita 20 mg, Lipita 20 mg daily, and her lipids have improved with cholesterol falling from 6.2 to 3.2. Yeah, like this. Next, Mrs. Sharma reports that her fasting blood sugar level is in the blood sugar levels are in the 16 plus range. Yeah. Whereas the whereas the other blood sugar and other blood sugars are 7 to 8. Yeah, 7 to 8. 7 to 8. 7 to 8. This is put in the fridge here. Put outside. This I kept for today. Yesterday I made all this. Yeah. Not chicken and pepper. Is it okay? If it is okay, what are you doing? Huh? We'll get anything, whatever you want. You tell me now, I'll get. Every day fish, fish, fish we are eating. If you want chicken means she likes chicken, we told. No, so I'll try to get chicken. I think if you Yeah, I am concerned about her fasting blood sugars, which I am going to improve these sentences. I want you to improve these sentences. Every sentence we have to improve. Okay. I am concerned about her fasting blood sugars, comma, which remain high and would appreciate your advice. Yeah. So 36 sentences. So this last sentence, I would appreciate your advice. This we can put in the center. Yeah. I would appreciate your advice. This sentence can be modified in many different ways. Yeah. So how we are going to write this sentence? I would appreciate your advice. Uh, it would be, it would be, I would be thankful to you. I would be thankful to you if you could provide expert guidance, expert guidance and appropriate management. See, I told you I will improve the quality. Don't think that this is the end of everything. I'm going to improve quality, improve quality, improve quality. I see no action here. Nobody is writing anything. Okay, if you write something, I will see that you will be interested. No? I would be thankful to you if you could provide expert guidance and appropriate management. Okay, or you can say um, she requires she requires okay she requires, yeah, that's good, Romasa. She requires um, she requires counseling. She requires education to manage her sugar levels. She requires education to manage her blood sugar levels. Okay. Okay, like this you can write. Okay. Education, relevant education. See, quality is improving now. Relevant education to manage her blood sugar levels is relevant education. Re- relevant education should be provided. Relevant education should be provided to manage her blood sugar levels. So 101 different ways of sentences you can write. That's what I'm telling you. Participate, participate, participate. Yeah, now I can see participation. Yeah. Okay. Based on the aforementioned circumstances, comma, okay. Based on the aforementioned circumstances, okay. Based on the aforementioned circumstances, um, ongoing care, okay. Based on the aforementioned circumstances, ongoing care and implementing the follow-up action plan would be would would undeniably or undeniably be of utmost priority or importance. Utmost priority. See the quality of the sentence. Based on the aforementioned circumstances, ongoing care and implementing the follow-up action plan would undeniably be of utmost priority. Okay. Next sentence. Next sentence. In case any additional information, in case any additional information is deemed extremely relevant, extremely prominent, in case any additional information is deemed extremely prominent, okay, please or kindly do not hesitate. Never write don't. Do not hesitate. Abbreviations and shortcuts are not accepted. Kindly do not hesitate to. Okay, in case any additional information is deemed extremely prominent, kindly do not hesitate to contact me. Yeah. So that is another sentence. These sentences you can use in every letter. Quality, 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 quality. Nothing less, nothing more. So one more sentence. Okay. So one more sentence, what we can give. Yeah. So uh, next sentence is an appointment, an appointment for the review of the review of cardiac, an appointment for the review of cardiac medications. Okay, an appointment for the review of cardiac medications an appointment for the review of progress. Okay, an appointment for the review of Mrs. Uh, Mrs. Margaret, Mrs. Lincoln, review of Mrs. Lincoln's health condition, an appointment for the review of Mrs. Lincoln's health condition on after 2 weeks. Okay, an appointment for the review of Mrs. Lincoln's health condition after 2 weeks has been scheduled. An appointment for the review of Mrs. Lincoln's health condition after 2 weeks has been scheduled. So not scheduled after 2 weeks, but after 2 weeks has been scheduled now. Okay, it's not scheduled after 2 weeks. It is scheduled for 2 weeks. For after 2 weeks, not after 2 weeks, for. Okay. So write as many sentences as possible. Learn all these sentences, please. Learn all these sentences. So I'll give these sentences to you in the groups, in our regular groups. Okay. So that is the end of the session now, and more to come afterwards. Okay. We have a reading session after some time. I'll send a message in the group. We have a reading session of that after some time. If anybody is interested in regular sessions, you can contact me on this number. Okay. So contact the admin. This is my number. Copy link for regular letter corrections. Okay. Contact for subscriptions. Yeah. So exam is going to be held this Saturday. So afterwards, okay, the batch starts on Saturday. That means tomorrow. I'll send you another link after some time for reading, a reading session. Yeah. Yes. So we are going to start the reading session after some time. So do not miss. I'll send you the link in the group.